Topsail Beach, and then we're gonna head home right now, and I have to get ready for tomorrow, check on, see how many patients I have to round on for surgery in the morning. Just unpacked all of our beach stuff. I'm in my pajamas and I'm just gonna prep for my patients tomorrow. It's like 8 p.m. or so. So yeah, I'm gonna check on how many patients I have to round on in the morning, and since I haven't been in since Friday, before Mondays, I like to read up on each of my patients so I kind of understand what's going on before I go in and check on them in the morning. Not looking great for tomorrow. I have a lot of patients. I'm probably gonna have to wake up in the 3 o'clock hour so that I can see everybody before the OR starts. Oh my God, I slept so bad last night and I'm on 24-hour call. I'm so tired. It is 4 a.m. I slept in a little bit. I called the night team and asked if any consults came in overnight, and they didn't, so I don't have to go see any consults this morning. So I usually will like lay in bed a little bit longer. I have a few patients to see this morning, and then I have the OR starting at 7:30. I'll probably try and grab breakfast before the OR. Sometimes I don't have time. Once OR is done and we finish surgeries, then I'll head over to clinic with the surgery providers, and I'll help out seeing patients in their clinic. Sometimes we get to do procedures in clinic, which is really fun. Like removing cysts or core needle biopsies, things like that. It's really fun. And then after that, I usually have didactics. So the afternoons always are different. Yeah. She is the size of a little cantaloupe. Aww. Guys, I am on my way to work. I'll catch up with you when I'm done. I have my smoothie, I grabbed my work laptop, and I'm gonna go see my patients. Oh yes, and on the way, I'm gonna listen to some country music, get myself hyped up for the day. I'm done for the day. It was a good day. It's 2:30 p.m. right now. I had surgeries, rounds, clinic, didactics, and then this afternoon we didn't have any new consults, and I'm on call, so I get to go home and take call from home. So hopefully I don't get called in because I'm really tired and I would love to rest. I think I'm gonna try to get a little workout in. I just got called in. I made a really quick smoothie because I had just finished working out, and I'm gonna drive to the hospital and see my patient. Leaves from our indoor garden. So cool. Just chilling with my plants. I made that big old salad for dinner, along with we had a bunch of leftovers, and did laundry, did our baby class, saw my consult, and now I am gonna watch TV. I didn't get called in yesterday. Good morning. There's no OR patients today, so I just have clinic, which means that I got to sleep in an itty bitty bit, and I'm just gonna go around on my patients. I feel so well rested. I did not get called in last night, and I went to bed at 9 o'clock, so feeling good. Time for my prenatals. And I'm wearing my wedding ring today, which I haven't worn basically this whole month because I've been in the OR and stuff, and I just don't want to bring it with me, so just have clinic today, so I get to wear it. Heading in, gonna go see my rounds patients, then head to clinic, then didactics, and we'll see what's going on this afternoon. Have a great day. Got done early today. One of my attendings was celebrating her birthday, so I had this great chocolate cake to eat later. Gonna do a little workout and then do some practice questions. Matt made dinner. What are we having, Matt?
Pasta Norma.
Pasta Norma.
Fresh basil.
A salad from we grow this lettuce. It's 5:15. Yeah, so I got the OR today and then didactics, and then I don't think we have clinic this afternoon, so it's probably gonna be a shorter day. Oh my gosh, my hair is so crazy. I'm just getting ready, cleaning up my whole house because my mom comes tomorrow. I'm so excited. So just like cleaning the whole house, doing laundry, the bathroom, all the things. I started studying for level 3 much earlier than I started studying for my other board exams because baby's coming and I'm trying to do as many questions as I can before she's here. So this time around, I'm only gonna take level 3. I'm not gonna take step 3. I'm gonna be using TrueLearn this time around because I love that it has osteopathic based questions. I went with one of their bundles that includes an entire Q bank. It also includes Picmonic, which uses visual mnemonics to help you remember important concepts for exam day. And it also includes a self-assessment, so I'll be able to see how I'm scoring before I take my actual exam. It's super easy to make a custom Q bank session. So lately I've been doing about 25 questions on tutor mode so that I can go through them as I have time throughout my day. So here is an example of a question that I answered. I love the diagrams and the detailed responses that TrueLearn gives. And they give you a bottom line, which is super helpful to just get like the big picture. Overall, I'm super excited to be using TrueLearn this time around, and I'll let you guys know how my level 3 exam goes compared to the other 2 board exams I've taken. So I thought we could just have a little chit chat about kind of how this first month has been going. So I feel like each week got progressively easier. So the first week I had no idea what was going on, like with the EMR, and it just felt so overwhelming. Like everything felt overwhelming. Whereas by this week, I think I'm finishing up my 3rd or 4th week right now. I have like such a better grasp on everything. I feel a little bit more confident. I know how to use the EMR. And I just can kind of know what my attendings are looking for me to do, if that makes sense. Like I can kind of anticipate a little bit more like what they're thinking. So let me talk a little bit more about what surgery month has been like. So typical day on surgery is wake up sometime in the 4 o'clock hour, get to the hospital, and I need to round on all of my patients and see any new consults before 7:30 a.m. Preferably before more like 7 a.m. so that I have time to like eat a little something and get to the OR to meet our OR patients before they go back for surgery. Consults take the longest because I have a lot more questions for those patients and I have a lot more to like tell the attendings. Once I get to the OR, we usually have cases from like 7:30 until maybe the early afternoon, but I have didactics that start at 12:30. So I'm usually in the OR from 7:30 to 12:30. And then I go to didactics. That's when I also eat my lunch from 12:30 to 1:30. And then after 1:30, if we have any new consults, I'll see them in the hospital. There might be afternoon clinic that I'll go to, or I can go home, but usually there's something going on in the afternoon. When there's nothing going on in the OR in the mornings, I'll head over to clinic and see outpatients for surgery. So that might include breast biopsies, like a cyst removal in the office, hernia consultations with the doctor before surgery, that kind of stuff. So it's been a really cool month because I feel like I've learned a lot about general surgery and I've gotten a lot of experience myself with working on my own suturing skills, and I really feel like I've gotten a lot better. Now I feel way more confident like holding the equipment and just like throwing sutures. Anyway, the other thing I wanted to add is since I'm going into dermatology residency, it was really important to me to have a surgery month so that I could work on my suturing techniques prior to derm residency. And I am really glad I picked a program with a surgery rotation, even though the hours can be like a little early or like there can be a lot of standing in the OR, that kind of thing. It was totally worth it. And that's me coming from someone who's 8 months pregnant, standing in the OR. The only other thing I forgot to add is that I did have 4 24-hour call shifts. So I was the first call if there was any surgical consults during those 24 hours. Overall, great rotation. I have my last few days now and I'm gonna read my book or watch TV tonight. I'm not really sure. Have some chocolate and then go to bed.